So we are going to be talking about successful first aid. And so let me see if I can get things rolling here. All right. So a little bit about what we are going to go over tonight. I'm going to give you kind of a brief refresher course on taking vital signs and the importance of vital signs in regards to first aid. We're going to look at some wounds, when to call the veterinarian, what do you do until the veterinarian arrives, or do you need to stop the bleeding and get your horse loaded and prepped to take the horse to the veterinarian. We're also going to look and talk about eye injuries. And then at the very end, I have a short 7-minute video about first aid kits. And so as we go along through here, anytime if you've got questions, just pop up, ask those questions. Or Melissa, I think, is going to be monitoring the chat room because I can multitask, but I can't do that all at once. But yeah, so if you've got questions, don't hesitate to hop on and ask those. The following presentation does contain graphic material, so viewer discretion is advised. Okay, I'm straight up, there's some blood in these pictures. All right, you get up in the morning, you get your coffee, you head to the barn, and this is what you find. Or this. Or this. All of these pictures, I have the stories behind, I have the results behind them. And so we're actually going to revisit all 3 of these at the very end. When you walk out and you see this though, what is the tendency to do? Panic. What do we not want to do? We don't want to panic. All right, because remember, horses, they feed off your energy. And so if you're panicked running around and just kind of almost hysterical, your horse is going to be like, oh my gosh, what's going on? She's upset. I need to be upset. And so take a breath. And essentially you are going to start by assessing the situation. All right. Within assessing the situation, we're going to look at bleeding. Are they bleeding from an artery? Are they bleeding from a vein? Are they bleeding at all? So we're going to assess that, and we're going to look at some different things on stopping bleeding and what we should and shouldn't do. We're also going to look at vital signs. One of the important things about vital signs is vital signs can actually be an indication of pain. And so we can assess those vital signs and kind of determine, is my horse in a lot of pain? Are they not? Have they lost blood? Are they in shock? And then lastly, behavior. Behavior is also a really important one because if they're acting off, that might also be an indication that something is going on. So 2 keys to successful and effective first aid. 1, don't panic. All right, take a breath, get your faculties about you, and then start working on your horse. What's going to help to keep you from panicking is having that well-stocked first aid kit and know where it's at. Okay, you don't want to be running through the barn looking everywhere for your first aid kit, or even worse is you get in there and you haven't restocked it and what you need is not in there. All right, so let's look at vital signs. We're going to talk about these 3 We're going to look at heart rate, respiration rate, capillary refill time, and temperature. All right, so heart rate. The heart rate for a normal adult horse, okay? And so we're kind of classifying adult as 3 years old and older. Their normal resting heart rate ranges from 30 to 40. The reason why I'm specifying this as an adult is their heart rate slows as they age. So the heart rate for, say, a newborn to a couple months old, their heart rate is actually 100 beats per minute is the average heart rate. And then about every 6 months to a year, we see a drop. So even our yearlings and 2-year-olds are going to have a higher heart rate than that of kind of our adult resting rate. A pulse rate of 50 or higher could mean physical distress. And so we're not going to talk about colic tonight, but horses that are in a lot of pain due to different types of colics, sometimes their heart rates are going to be in the 100 and something. 70s and 80s are not uncommon. And so one of the other things I really want to stress is I'm going to ask you guys, how many of you know your horse's resting and normal vital signs? Okay. It is really important to know what your horse's normal is. You need to have that baseline. And so one of the best times to do it is, they're kicked back, they've eaten their breakfast, or maybe they've eaten their dinner, they're just relaxing. Go take it then. Okay, go get their vital signs then. You don't want to do their vital signs at feeding time because they're amped up and they're excited because food's coming. And so do it at a point when they're resting. Because the variation off of normal is really going to help you zero in on kind of the pain level of that horse. Okay, so resting rate for an adult is 30 to 40. Some horses run low, some horses run high, but grab that baseline. So to take the heart rate, the most accurate method is using a stethoscope. And let's see if I can get my little laser pointer here. All right, so using a stethoscope on the left side of the horse. All right, the heart sits on the left side, and so that's why we check for the heart rate on the left side. We go in right behind the elbow in this pocket area, and you can count. You can count for 15 seconds. You can count for 15 seconds and multiply by 4 to get your beats per minute. Or if I have a horse that is kind of a little colicky, not really feeling good, I will actually count to 30 seconds and then multiply by 2. So, but yeah, so in that pocket on the left side, this is the most accurate method, okay? Now, if you listen to your horse's heart rate with a stethoscope, you're going to hear a dun 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 dun. What that is it's the blood moving between the chambers. That is 1 heartbeat, okay? So that dun dun, that's 1. That's not 2, okay? So that's 1. And that's really important to take note of that. Okay, so there's another spot that we can take the pulse, but really this is very variable on horses whether you can even feel it, and it's on the inside of the jaw. And so you go up to the center and then come out to the jaw, and there's a whole grouping of arteries and veins that run through there. Honestly, it's kind of few and far between if you can find it. Then there's actually an artery that runs right here behind the eye. that's another location. If you need to, that would be another location. The key is, though, you use your middle and ring fingers. If you're feeling for the pulse, you use the middle and ring finger, because remember, your pulses are in these fingers. Okay, so middle and ring finger. We can also feel pulses in the lower leg on the back side of the fetlock. This is what we call digital pulses. But oftentimes, if we feel really strong digital pulses, that's indicative that something is going on in the hoof. Whether they have an abscess, they have a bruise, heaven forbid they're developing laminitis. So feeling pulses back here, the digital pulse, that is not necessarily a good indicator of their heartbeat, okay? All right, respiration rate. The average rate for an adult is 8 to 24. So that's like a huge window as far as respiration rate. And so this is one, definitely know what your horse's normal is. And remember, as your horse becomes more fit, their respiration rate is actually going to decrease, just like it does in people, okay? And so this is another one, because a high respiration rate is another indicator of pain. When we take respiration rate, you may want to have a tendency to do this, all right? This is not how we check for respiration rate, because if you think about it, if you put your ear down to your horse's nose, what are they going to be doing? They're going to be sniffing you, going, oh, your shampoo smells really good, or man, you should have taken a shower today, okay? And so this is not the way we're going to check respiration rate. How we're going to check respiration rate is we are actually going to watch the rise and fall of the rear flank, okay? The rise and fall is one breath, okay? To do this, we are actually going to watch them and time them for a full minute. Namely because some of these horses that have a really low respiration rate, you cannot get a respiration rate on them if you just count for 15 seconds. The range is 8 to 24. We actually had a school horse here at OSU. His respiration rate, his normal respiration rate was 5 breaths a minute. And so, you know, and he was healthy. But so that's one thing, you know, you need to know what that norm is, and you need to count it for a full minute. All right, beware, the respiration rate should never exceed the pulse rate. If it does, there is something going on with that horse, whether he or she is in a lot of pain. If this continues, they can actually change out and become almost hyperoxygenated. And so then that can cause some other issues that you don't want to be dealing with, okay? All right, so capillary refill time. Normal capillary refill time is 1 to 2 seconds. So a lot of times, and I'll show you guys how to do this, you don't even get one out of your mouth and the color has come in. If the CRT is over 2 seconds, that horse might be in shock or under some sort of high distress, like maybe a pretty severe colic. So with our CRT, essentially what we're doing is we're going to kind of evaluate the gums. What color are they? Normal color is what I call baby girl pink, is kind of what the normal color is. Some horses will vary, but kind of this pink color. So when we're going to take a CRT, what we're going to do is we're going to press on that gum, blanch it, and pull away. It's just like you guys, if you want, take and do this, and then lift it, and you'll see how it blanches the color out and that color returns. That's a capillary refill. And so with horses, this is where we can do it. All right. So you remove your finger, you start to count 1/1000. Most horses are going to be back in less than 1 second. If it takes longer, you need to be calling the vet because something's going on. All right, then rectal temperature. So rectal temperatures, we are going to do, we're just going to use a digital thermometer. These are great. Just be sure to get the waterproof ones. And so rectal temperatures, average for all horses is 99.5 to 101.5. And again, we're gonna get bombed here again. It's really important on this one that you also know your horse's normal, because a mild fever is right around 2 degrees higher than normal. So if you think about it, if your horse runs 99 degrees and a fever is classified as about 2 degrees above normal, they can still be in the normal range, but be running a fever, okay? And so again, this is really important. I've actually seen quite a few horses here recently that are running clear down normal 98s. Okay, that's kind of their normal temperature is in that 98 range. So if you guys temp your horses and they're in the 98 range, don't stress, okay? It is not uncommon. So one other thing, like I mentioned, we're not going to get into colic tonight, but if you're assessing your horse, if something's a little off, the other thing that I always assess for and listen to are gut sounds, okay? And so gut sounds, they should always be present to some extent. If you cannot hear anything, you've got problems. What we have been running into and what I think a lot of people are seeing right now with, we've been experiencing this wonky, crazy winter weather. Horses have a tendency to go hyperactive and develop spasmodic colics when we have a huge change in the barometric pressure, okay? And so, so hyperactive can also be indicative of colic symptoms. When we are listening to gut sounds, we want to listen on all 4 quadrants. So left upper, left lower, right upper, right lower, and then I also listen to midline. Okay, so you want to hear gurgling and churning and bubbling and all kinds of stuff is what you really want to hear. If the gut sounds literally sound like they are having a party, they're hyperactive. Okay, and it's with hyperactive, usually a little bit of Banamine, it'll calm them down and you're usually good to go. All right, dehydration. Healthy horses will drink a minimum of 5 gallons of water per day. Okay, that's bare minimum. Ideally, we want these horses drinking 10 to 20 gallons of water a day. Okay, so if something happens and you are worried that your horses may be dehydrated, we can do what we call a pinch or a tent test. And literally, we just pinch the skin up, and ideally, that skin pops right back down. If the skin stays tented, then that's kind of an indication of dehydration. And there's different things that you can do to get them to drinking. You can put salt in their grain, salt washes, different things as far as trying to get them to drink. There's little tricks like that. All right, then mucous membranes. This is a little bit more difficult, but we can look at like the whites of their eyes. Again, we can look at the gums, which we would look at the gums when we're doing their CRT. You can look up inside their nostrils. Color is a good indicator of blood flow. It's also an indicator of hydration or lack of hydration. So gum color. Normal, I mentioned, is kind of that baby girl pink. This little bay horse is showing his pearly whites to us here. Kind of a bright red is usually an indication of mild shock, whether they have gotten into poisonous plants, different weeds, different things like that. Then the really scary one is actually when they get red and almost like a purplish blue color. This is an indication of severe shock, which is usually something is going on internally with their GI tract. So dark purple, that's bad juju. And then also if they go white, like I mentioned, that's kind of an indication of dehydration and blood's just not flowing the way it should be. All right, so I mentioned behavior a little bit ago. Are they acting abnormal? Are they acting weird? Are they nervous? Are they shaking? Which quivering is also an indicator of pain. And then if we look on the colic side of it, are they pawing, rolling? Are they laying down at an odd time? You guys know your horses and you know what's normal and what's not normal. And one of the biggest things is trust your gut. If your gut is telling you something's off, there's a good chance it's off. Okay. Any questions on any of that before we go into some of the wound and first aid part? All right. So wounds. When do we call the vet versus when do we just take care of it on our own? Okay. So a couple indications or indicators that you may want to call the vet is if we have big gaping skin edges. This is actually a horse that tangled with the top of a horse trailer. And this white right here is bone, okay? So anytime bone is involved, you definitely need to be contacting the vet, namely because bone infection, systemic, does not turn out well. Head wounds. The other thing with head wounds have a tendency to heal better if they are sutured, okay? And so you would want to come in. I don't have any after pictures of this horse on this presentation, but they actually came out, they cleaned it up, they sutured it up, and a few months later, you'd never even know that he had skinned his head open on the top of the trailer, okay? This picture down here, this is bone, and these are tendons and ligaments. Okay, we're going to revisit this horse again. The other thing too is if it's directly over a joint, we want to look for synovial fluid. Okay, synovial fluid is a clear with a little bit of yellow tinge, and it's viscous. Okay, so it'll string between your fingers. If there is synovial fluid present, that actually means the joint capsule has been involved, and this is an emergency. Because if the joint capsule is involved, they can get infected and it can go systemic, and you could potentially end up losing your horse's life. Okay, so anytime joints are involved, joint capsules are involved, your vet needs to be right in the middle of that situation. And then also, if lameness is present, the varying degrees of lameness may, give you some indication if you want to call the vet. One thing to remember, Okay, it's one of the great things about technology now. If your horse gets hurt, and yeah, I didn't put these pictures in there. If your horse gets hurt, snap a picture, send it to your vet and go, what do you think? All right. And so that is one of the great things with technology and our phones having cameras. And it's amazing what the vets can analyze and go, yep, I'll be there, you know, in 30 minutes, or you're good, wrap it up, clean it up, you're good to go. But the best thing is don't wait. Talk to them, touch base with them. Like I said, send them video or send them videos, send them pictures. The other time that we would want to call the vet is if we have excessive bleeding. And then also if the wound appears deep, swollen, or there's drainage. This particular picture, this horse had a tangle with a cattle guard and he lost. Essentially, he tried to jump a cattle guard and the back legs went down in through the grates of the cattle guard. And so you can see there's some pretty severe injuries here, but no broken bones. So, you know, it did end up being okay. All right, what to do until the vet arrives. All right. So this doesn't look like that bad of a wound, does it? Okay. By the time this wound was all said and done and all cleaned up, it was actually bigger than what it really appeared. And he ended up having sutures in his shoulder. Okay. But what we want to do until the vet arrives, one, keep the horse calm, keep him in a safe location. If you have to bring him in out of a herd, don't be afraid to bring a buddy in with them to keep them quiet. Just different things like that. You want to set these horses up to be calm and quiet. All right. Stopping the bleeding. We're going to look really quick at just a pressure bandage, applying pressure. Okay. Like physically applying pressure. You can do all of those things to stop the bleeding. You want to keep the wound as clean as possible, and then possibly wrap it if it is, say, on a lower leg, and you can wrap it and wrap it safely. All right, so stopping the bleeding, you can apply direct pressure by hand, or you can use a pressure bandage. So this is just an example using a set of quilts and a track wrap to apply pressure. Regarding pressure bandages, I have here, do that only if you know how to apply one properly. There's kind of some give and take. If you need to get the bleeding stopped on a horse and the vet is on their way, or you're loading the horse in the horse trailer and you're going to be at the vet within less than an hour, go ahead and wrap it tight. Okay. Because you're not going to do the damage versus if you put on a pressure wrap and you did it improperly and then 24 hours later you take the pressure wrap off, okay, then you could potentially have done tissue damage. So whether you apply that pressure wrap kind of depends on how quickly the vet is getting to you or you are getting to the vet. This was actually my mare. She lacerated a vein in her hock. Okay. And so to stop the bleeding, and this is one of the things you guys are going to see in the first aid kit. In your first aid kit, you should have things that are absorbent. One of the best things to have in your first aid kit are actually sanitary napkins. It is amazing what you can do with sanitary napkins and elasticon or tape. Okay. And so that diapers, towels, Like this is disposable cotton. And essentially what we want to do is we want to layer the material. And one of the things is you don't peek and look underneath those layers until the vet is there and he is the one that's looking underneath the wrap, okay? Because essentially we don't want to break the clot loose. Just to give you an idea, she had multiple layers of disposable cotton. She had the brown gauze. Then we had 3 layers of vet wrap. And then this one, she actually bled through. You can see right here, she bled through. So then here you can see I have added yet another layer to all of this. And essentially this first initial one was done by the vet in Salem where this happened. I put this top layer on because I talked to my normal vet. We put this top layer on, and then essentially the next day she came out and started taking everything off and undoing the multiple layers. Okay, so it's kind of crazy, and believe it or not, all of this blood, and you can see it has bled through all of these layers. When it was all said and done, the cut itself was less than a 1/4 inch wide. Okay, but it hit her vein. But yeah, the cut itself was less than a 1/4 inch wide, and it did all of this. Okay. So once in a while, you'll have wounds that don't have a whole lot of bleeding. And essentially we can come in, we can clean those up. Cold hosing actually is very soothing. And the example that I always get is if you guys are in the kitchen cooking and you accidentally slice your finger as you're dicing stuff, what's the first thing you do? You put it under cold water, right? And so essentially we're doing the same thing for our horses. We're gonna cold hose this. It's soothing, it's gonna help clean, it's gonna help to keep the swelling down, you know, and you don't have to do it for a long time, just even 15 to 20 minutes. Just a little disclaimer, this almost looks like a cougar attack or cougar claw marks across here. This is actually from No Climb Horse Fence. We had a horse literally go over it. She went head over tea kettle over the top. And this is essentially what happened when she came out the opposite side. So cleaning our wounds, we can use kind of 2 different substances. You can use straight water, okay? You can use straight water, nothing, or you can use either dilute like betadine or a tinctured iodine. The rule of thumb is dilute it to where it's weak tea color, which is about 1 part antiseptic to 10 parts water. The other thing that we can use, but you do have to be careful with this, you don't want to use this on the face because you don't want to get it anywhere near the eyes, is we can use chlorhexidine gluconate. Okay, this is different than Novosan, which is chlorhexidine diacetate. We don't use chlorhexidine diacetate to clean our wounds, okay? And so we want to use chlorhexidine gluconate, and we're also going to dilute this out to where it's a light blue in color. When you're flushing out a wound, don't hesitate, get a syringe. You can get a really good stream of water with a syringe, or if you've got pockets, you can get down in those pockets using a syringe. All right, so standing wraps. This is kind of a variation off of, let's see if I can get this to play. Oops. This is a video. that for some reason is not playing. There we go. Had to get rid of the laser pointer. So this is just an example of a basic standing wrap, which we can use standing wraps for a multitude of purposes. So this is using a no bow, and then we have a quilt over the top. It's always good when you're doing your standing wraps to stay squatted down so you can move with the horse, like what I'm having to do here. She was always kind of a fuss budget to have her legs wrapped. This is actually the same horse you guys just saw the hock wound on that had sliced the vein in her hock. This is that same mare. So a standing wrap can be used over wounds to reduce swelling. We can also use this standing wrap if we're trying to do a pressure wrap. Okay. All right, eye injuries. One of the things about eye injuries is call the vet regardless of how serious you think it may or may not be, okay? One of the things with eye injuries, they either heal really quickly or they go bad really quickly, okay? And so this is one you definitely at least want to touch base with your vet. If we've got weeping, seepage coming out of the eye, this little mare, you can see the whole top part of her eye is swollen. This was during fly season, so we think she actually hit one of her herd mates while she was flies. So all of this we want to at least touch base with the vet. And then worst case scenario, or what we really don't want to see, is we don't want to see white or bluish tinge on the cornea, because that means the cornea has actually been injured. Amazingly enough, I know these eye injuries look really, really gruesome, but amazingly enough, eye injuries heal really well, okay? So essentially, they're going to come in, they're going to suture, and I kid you not, within a month or so, you would never know that they had done this. They heal really well, but they do need to be stitched up, okay? And crazy enough, this is one of the reasons why I always tape the bales on buckets, because you think about a bale on a bucket, it comes back around and then loops up. Those are classic for doing these to horses because they get to rubbing. So that's one of the reasons why those are always taped. Okay, we always tape those with electrical tape. Also, if you see a visible foreign body, we actually had a mare here at the school. Her eye was really weepy and she came in and it was closed. Got her to open up her eye. She actually had a piece of hay stuck this way through her eye behind the outer layer of the eyeball. Okay. And so sometimes you just never know how. One of the things we can do with eye injuries, especially if they're really weepy and maybe swollen, you can rinse the eye with saline just to clean and flush it out. We usually use, it's literally called eye wash. We get it from the drugstores and Mart or wherever. And so we'll use that to rinse eyes. The other thing you can do, like what is the example here, is you can use a really super cold washcloth and do just a cold compress on that eye to reduce the swelling. And it's amazing how quickly these horses figure out, you know, that cold compresses on their eye. They'll actually take a breath and drop their head because they realize it feels good. Okay. One of the biggest things with eye injuries is do not put eye ointment in until you have talked to the vet and the vet has come out and done a staining on it. Okay. So this picture right here, this green, this is staining that has been taken up by an ulceration in the eye. Okay. So this eyeball has gotten ulcerated somehow, and this is stain that has been taken up. If you were to unknowingly put an eye ointment that contains steroids in it, like hydrocortisone or dexamethasone in this eye, you can actually delay healing and cause bigger issues. Okay, so don't ever put eye ointment in eyes until you have talked to your vet and they have potentially stained it. All right, so first aid kits. First aid kits are extremely important. Have them in your barn, your horse trailers. They have the little saddle packs now that you can fill up with stuff for trail rides. So let's talk first aid kits. And this is about a 7-minute video. Let me see here. We're going to see if technology is going to be on my side tonight. Okay, do y'all see a video with the back end of a horse trailer?
Yeah.
Toolbox. And so you can use a toolbox. So a really important thing,
Can you guys hear the audio?
Is to have a well-stocked first aid kit. This first aid kit is one that I keep in my horse trailer. I also have one exactly like it in the barn. And you can be inventive with this. This is just a toolbox. And so you can use a toolbox, you can use a heavy canvas bag, anything. One of the keys is organization, because the last thing that you want to be doing is searching through stuff when you're looking for something when you have a horse that's injured. So being well organized and well stocked is a key thing. You should go through your first aid kit once or twice a year at the minimum to make sure everything is stocked and that there is nothing that's expired. In this first aid kit, this is the one I keep in my horse trailer. So not only do I have things that would function as a first aid for horses, but I also have some things that would function as first aid for people. You know, I have Excedrin, Tylenol, things like that, hand sanitizer. So not only can I doctor my horse, but I can doctor myself if needed. So some of the main things that you do want in your first aid kit are some of the things that we would use to take vital signs. I have a stethoscope. You do not always wear a watch. I would also recommend to have a stopwatch in here so you can take those vital signs. If you're like me, I always have a watch on my wrist though. So stethoscope, thermometer. The other things, I also have my lube. The other things that I'm going to have in here, as you can see, I have syringes. I also have some needles. This would be if I had a horse that I needed to do an IV injection to of Banamine or something like that to reduce pain, I can do that. Now, you need to be trained. I've been trained on how to do IV injections, so I can do those. If you don't know how to do IV injections, don't do them, okay? But I have these on stock, on hand. The other reason why I have syringes on hand is if I have a horse that gets injured, say, you know, she cuts a leg or something like that, and I really need to clean out the wound, I'm going to have my syringes so I can actually flush out the wound. I'm not opening any of these because these are all sterile. And so that's the other important thing, is to have your equipment to where it's sterile. So syringes, multi-purpose. Always have scissors. The other thing that people often forget about in their first aid kit are flashlights, and make sure that they work. This one does work. It's weak, but it works. The reason being is it never fails. Your horse gets hurt when you're at a showgrounds or rodeo grounds or out in the hills. There's no light and there's no current bush to plug a light into. So always have a flashlight so you can get a better view of whatever injury or assess whatever you're looking at. The other thing I have in here is just sterile wound wash. It's just saline. And this is in a spray form because oftentimes, especially if you're in the mountains or anything like that, you're not going to have, you're not always going to have access to water. So always have this on hand. And ACE bandages, elastic bandages. This is one of those multi-purpose things. I can use it on myself or I can use it on my horse. Couple other things. Tweezers. Set of hemostats if I need to get a hold of something. And I do have an old pocket knife. I always carry a pocket knife, but this is good to have. You never know when you need to cut something or pick something out. So that's all in the top tray. The bottom tray of my first aid kit has things to clean, as well as things to pad or wrap if we have a wound that's bleeding. Always have little alcohol swabs on hand. You can use these after you've taken a horse's temperature. You can also use them for cleaning wounds on you and the horse. Band-aids. Always have gauze wrap. Again, this is all sterilized. They're in their individual packages. So have gauze wraps or gauze pads. This is not a non-stick one, but it's also a really good idea to have non-stick gauze pads. I have rolled cotton in here. I have this wonderful stuff. This is called cling wrap. This is great for wrapping wounds. The ever wonderful Elasticon. If you're not quite sure what Elasticon is a very strong adhesive tape, but it's stretchy. And so you can use Elasticon for all kinds of things. You can actually make a horse-sized Band-Aid using Elasticon. Vet wrap, latex gloves. I also have a cold compress in here. Again, multi-purpose. You can use it on yourself or on your horse. And one of the last things that I have in here this is just rolled cotton. We can use rolled cotton on a bleeding wound that we're trying to get the bleeding stopped. The other thing I always have in my first aid kits, and it's because they are great for helping to absorb and stop bleeding. You can put them into different configurations, and that is literally feminine sanitary napkins. They're great in your first aid kits. They don't take up much room, and you can use these and the Elasticon to do all kinds of configurations to put on wounds. And if the bleeding bleeds through, don't remove it. You literally just keep packing and padding on top of that wound. So that's a basic first aid kit. So a really important thing, if you have horse,
What? Okay.
Hey, Dawn, there's a couple requests if you would be willing to share the link to your first aid kit video
Yeah, let's
in the
see.
chat, or I can send it out in the follow-up email too if you want to get it to me later.
Let's see if I can.
And Ruth has a comment in there about her first aid kit. Ruth, do you want to unmute yourself and just share about that real quick while Dawn is looking for that link?
Okay, a few years ago, I was lucky enough to attend a technical large animal emergency rescue training in Corvallis. And one of the things that they showed us was the head protectors for horses, equine head protectors. And I got to looking at that. I thought, I don't have a lot of money to spend. And so you can find adult life jackets like all over the place at thrift stores and stuff. And so I brought a pony sized one home and tried it on my pony. He was not thrilled, but you can, I don't have a good picture to share right now, but you can change the, cause it tightens with the clips and stuff. And so, bring it home, try it on your horse. If you have a horse with a head injury or something and you're transporting, the equine head protector is designed to help keep the horse from bumping too hard. And then it's also if you have to blindfold a horse, right? It's kind of hard to tie something on that head. You can put the towel over that and then put that life jacket around and it fits perfectly. I've tried it now on my large horse as well. And well, I certainly don't recommend going a cheap route. It's just a good substitute to have on hand if you need something.
Yeah, yeah. Yeah, and sometimes you do have to get creative. I didn't put a picture of it, but I had, well, in fact, it was that little buckskin mare that you guys have seen on here. She injured her eye and they had to, one of the things I had to put on her eye as a treatment was a dilator. But she was not a stall pony. And so kind of the same thing, you have to get creative. And I have this really cute picture of her with a fly mask with a piece of jeans, denim over it. So she looked like she was a pirate with, a patch over her eye. So yeah, sometimes you've got to get really creative. So yeah. All right, can y'all see first aid kits again? The screen? Okay. All right. So in summary, don't panic. That's the big thing. These horses are going to feed off of you. So don't panic. That's going to help keep your horse calm. When in doubt, call the veterinarian. In fact, talking with a lot of different veterinarians, they would rather have you contact them and have it be nothing than have it be something and then you're calling them, 24, 48 hours later. Hang on, I got to shut my door. I have a bird that is literally going to town outside my door. He was like really loud and very distracting. And so, but they would rather have you call and have it be nothing than have it be something serious. So successful first aid leads to successful outcomes. Okay. So here's kind of a little progression. This is actually my gelding. And he decided he was going to paw through and catch his foot on a brace, a wire brace. Completely slipped off the back side of the hoof, took his shoe off in the whole 9 yards. 2 weeks later, after he had been wrapped, and actually they put him in a cast, 2 weeks later, this is what it looked like. And then a few more weeks later, this is what it looked like. It grew out. You'd never know that he had ever done that to look at him now. Okay. So this little mare, this actually happened here at the horse center. Can y'all see this print? She literally got kicked in the face by another horse. And the toe of the horse's back foot hit right here, and it actually broke the nasal bone and dropped the nasal bone down into the sinus cavity. Okay. This was the day of. They literally ran a catheter down through the hole. The owner of this little mare literally had to come out 2 to 3 times a day and flush. She ran saline through this multiple times a day to keep all the blood clots cleaned out of the sinus passages so she could breathe. So she looks pretty bad here. That was her a few months later. You can hardly even tell that she had injured herself. She had not changed. It did not affect her mentally. And you can barely see where that was done. But the owner was very, very good about coming out and taking care of her. Okay. This was what one of my students went home from class to. They don't know if this mare was kicking at another horse or exactly what happened. Essentially, they ended up, the fire department came out. The fire department ended up having to cut these pipes. And you saw this mare already. That was her. Okay. So this is one of the ones that we saw on the very first slide. This is her lower leg that you guys saw earlier. Well, here's the bone. She completely cut through up here on her inside gaskin muscle. It took her a year to heal. And it was a year before she was able to go back to work. And that was starting out hand walking. They sutured this. I don't have any pictures of after she healed, but I do know it took her over a year or right about a year for everything to heal to where she could go back to work. She was a little reigning mare. So you can imagine athletes are a little bit hard to keep calm and keep quiet, but she did heal. She did go back to work. And with that, any questions? This is my wild child. You guys have 2-legged wild children. Here's my 4-legged wild child.